one thing that has come out of a lot of heart illnesses is that a number exacerbated by poor nutrition. So we will combine that, and without further ado, allow me to introduce Dr. Stephen Omondi, who is a physician and cardiologist at the Karen Hospital. Karibu sana, Doc.
Thank you so much.
And thank you so much indeed for making time.
It's a great honor.
Just next to him, we have Josephine Mbuthi, who is a nutritionist with the Karen Hospital. Karibu sana.
Thank you so much.
And first things first, Doc, we are seeing a rise in the number of heart conditions in the country. Maybe you can give us a brief overview. What exactly, when we say heart failure, what exactly do we mean?
All right, thank you. So when we say heart failure, you know, the heart is a pump that pumps blood. So when the heart is not working well, that's heart failure. And when the heart is not working well and the person is having symptoms because that is not working well, that all doctors agree it's heart failure. Just to say a bit more, the heart may not be working well because it is weak, so it can't pump. When it receives blood, it doesn't pump out enough blood to meet the need of the body. Or the heart may be able to do that, but it is so stiff that it's not very easy to feel. So it's difficult for the heart to feel. So you can either have a situation where the heart is weak, so that is not pumping well, or the heart is too stiff. Commonly, it's a combination of the two. We get to know the patient got heart failure because of how they feel. So you may have those conditions but don't have any symptoms. So when you have the symptoms is when you know, oh, this is heart failure. So to summarize, it is a pump that is not working well. The pump being the heart is not working well. That's what heart failure is.
And it's a good thing to note that you have over 30 years where you've had an initiative to ensure that you have an event that caters for heart. You have runs. I've seen a number of hospitals do the same thing. Maybe you can touch on that before we unpack the whole heart condition.
Yes. So heart failure is such a serious condition. It's very common, and there's been a concerted effort among stakeholders to try and control the levels in the country. So at Karen, we do quite a bit. We have the heart run you're talking about. We run several clinics. We run a dedicated heart clinic in the hospital itself. We see on average about 80 patients a day. Majority of those, not the majority, about a quarter of them will have established heart failure. The remaining, about a quarter of them again will have hypertension, which we'll talk about as a major risk for heart failure. The remaining about half of them would have conditions that if not treated will actually eventually result in heart failure. So you see it's actually the entire clinic is all about heart failure if you think about it, the different stages of heart failure. Then we have satellite clinics, most of them are in central Kenya, so we have in Nakuru, we have in Meru, we have right here in Thika. Those clinics, we run a clinic every week, and we see 2-day clinic every week. And we see about 120 patients in those clinics. And again, the proportion will be the same. About a quarter of those will have established heart failure. The remaining ones will have risk factors that if not treated will eventually result in heart failure. So it's a major problem. Worldwide, we have about 64 million people that have been recorded as having heart failure. In Kenya, we may not have very concrete data on how many patients we have. But similar to Karen, the other places are reporting similar numbers. So we know it's a growing problem, increasingly growing problem that needs to be addressed. So indeed, heart failure is a major concern.
Josephine, they say garbage in, garbage out. We are what we eat. How are heart conditions related to nutrition?
Nutrition is key, both even in prevention and in management of even the heart diseases. But in nutrition, it's not really what you're eating, but also how much you're eating. And worldwide, you find that obesity, overweight is also a cause of or basically a risk factor of even some of the heart failure, or risk factor of heart failure. But even what happens is that you find that the choices that we are making is what the food choices, the lifestyle choices that we are making is what that is increasing our chances to heart failure. Like globally, half of the population right now, even in Kenya, we have both obesity and overweight. And you see right now, because of the diets, and especially right now, we are choosing more of the convenience foods. Other than getting a healthy meal, you find that because of even time, the work generation, you find that we do mandazis, we do chapatis, we do chips. Like right now among the young people, the takeout is mainly chips and chicken. So with that, they carry on those those lifestyle practices even in their adult ages. And you find that even in heart failure and even the diseases like hypertension, it's not a one-day event. So it's chronic. That means it took time, and it's a collection of the choices that you make. So even in terms of nutrition, and that is why even as Karen Hospital, much of the 80% or more of the patients that we see daily are either overweight or obesity, and they've come also with other conditions like diabetes, hypertension, that also put them at risk of heart failure.
And in a continent and in a country where the bigger you are, the more healthy we view you, how do we change that perception? Because the obesity is something that a lot of people do not think is a risk factor. They think it's healthy, and when you have a big tummy,
you're richer.
Yeah, you're richer, and you're more respected. So a lot of people don't take care of the bodies. The bigger you are, the better.
What I can say, yes, tradition, the way we've been brought up knowing, even when you get married, you're told you have to feed your husband. And even for you as a spouse, your husband has to really feed you, because the more you increase in weight, the more they think that you're doing well. So you find that it's basically education. We do a lot even when it comes to educating them about the pros and cons of having, of being actually overweight, of being obesity. And because that is that is increasing the risk of all these issues. So it's basically education and awareness, and that's why also many people or many hospitals are partnering even with the media, be it audio, print, and visual, to try and educate the public that whoever you are right now can be a reflection of what you get in the future. Yes. And
when we talk about heart failure, are we talking about something that cannot be corrected, or there is a remedy for that? Because I'm looking at an engine perspective. When we say that vehicle has an engine failure, there's something that we can do, and maybe we can even replace that engine. What happens when it comes to a person?
Yes, indeed, heart failure is a serious condition. It's life-threatening. Sometimes actually it shortens the life of a person. It's life-limiting. You live with it, can be quite life-limiting. You're not able to do the things you want to do. But there's good news, as you say. There are very effective treatments currently available right in our country. And a lot of the patients that we treat that are on those medicines actually able to lead their normal lives. And a lot of these people will live a long life. So indeed, it's a serious condition. It can limit your life. It can limit your ability to do your physical activities. But there's good news. Apart from medicine, so medicines are available all over the country. The reach may not be as we would desire. We'd want more people who have got heart failure to get these medicines at affordable rates. But in any big center, you'll find the core medicines for heart failure. And the doctors know about them, and they do prescribe them. Now, when those medicines don't work, sometimes we have other devices that we can give. There are special pacemakers that can be implanted to help the heart coordinate how it pumps. Now, those are not available everywhere. In Karen, we do have them. In Nairobi, we'll have centers with those as well. So those can be used to help the patient as well. Many patients with heart failure die from abnormal heart rhythm, so they die suddenly, and you need a special devices or pacemakers in quote that can be used to prevent those sudden deaths. So this treatment is not all bad news. If you don't treat it, it's actually more dangerous than actually many cancers. But when treated, you can live a normal life. So the message would be, fine, it is a condition that can limit your life, but if you treat it, you will live a relatively normal life. Of the quote I was telling you about, when you sit with them on the bench, you will not know which of them actually have got established heart failure because they're already on treatment, they're doing well. It is very rare that we find the patient that is refractory to treatment, that is resistant to treatment. Now, is that small percentage, less than 1% in fact, that may require a referral elsewhere for a cardiac or a heart transplant. But it's not actually off the mind. I cannot remember one patient in my practice that had to go abroad for a heart transplant. So it's one of those conditions that you can actually be treated right here in Kenya, effectively right here in Kenya, and the treatments are available. And from the majority, they don't even require the devices that you need to come to Karen for. They just require to be seen in Karen for the medicine, or that's what that offer a heart failure. But now the small percentage that require these devices, they're available here. We have the technique to implant them, and they help patients a lot. So yes, so a serious condition, but has got treatment. Yeah.
How widespread is it? Because I'm looking at the medical scape in the country where a lot of people do not go for diagnosis. You know, you just decide today, let me just go and find out how my kidney, how my liver, how my heart is. It's only when I hear a sharp pain somewhere or I have some symptoms, that is when I go. And I believe that is why we have so many cancer cases, because they are diagnosed when it's too late. How widespread is it in Kenya? And diagnosis themselves, diagnostics of any heart condition in the country.
All right. So the good news is that heart failure as a condition itself is actually a disease. So it's a condition, it's a syndrome that is where you arrive from many diseases. So there are many diseases that can cause heart failure at the end. Now, heart failure itself can be diagnosed easily just by talking to the patient. But to be able to categorize the patient and say this heart failure is coming from this condition, I should be treated this way, that may require some special attention, and that's where the heart doctors come in. So with a simple ultrasound called an echocardiogram, you can be able to tell which kind of heart failure you're dealing with and treat it. We have a device called an ECG that studies the heart rhythm, and from that we can tell roughly what's causing your heart problem. Because some people get heart failure from very fast heart rhythms, for example, or from very slow heart rhythms, and those can be treated. I said before that heart failure is a serious condition in most cases, but there are actually some cases where you can actually completely reverse the heart failure. So you can treat it and actually cure it in some cases. Though majority of patients that have got heart failure have got a problem with the heart muscle from different conditions, and those may not necessarily be cured, but they can be treated very effectively and they can live long. But they are both seeking healthcare and just trying to find out what do I have. My colleague Josephine has said correctly that hypertension is the most common cause. The majority of patients that we see in Kenya with heart failure actually have got untreated hypertension. And to diagnose hypertension, you just need to put a device on your arm, dial it, and get a reading. Once you get that reading, interpreting is actually not very difficult because there are many devices that can tell you what the readings are. But just the exercise of just checking your blood pressure, and once you're diagnosed with hypertension, treating it, that will eliminate quite a number of people that we see with heart failure. Because in our country, untreated hypertension is actually the most common cause of heart failure. The other causes where the valve has a problem in children, for example, is a common problem. And those two, just with an ultrasound, we can tell that your valve has a problem and it is severe enough to require treatment. Many of those people that have got severe valve disease will require surgery, and even that is available right here in Kenya. In fact, Karen is one of the centers that offer the valve transplants and all that. So to diagnose it, you just need to talk to a clinician. They don't have to be very specialized in their field. They'll know because it's a syndrome. Based on a list, they tell, oh, this patient most likely has got heart failure. Now from there, you may need specialized tools to be able to tell which kind of heart failure is it, about treatment that you really need. Yes.
All right. From that, we are discussing Matters Heart Failure Awareness Week, which began on the 11th. We're going to go all the way to the 17th, and I have experts from the current hospital to help us understand some of the questions, some of the issues that come around in regards to heart failure. And just a quick one is that the current hospital is also taking part in the awareness campaign because it's a global thing, and they are also having a specific checkup promotion for both men and women. And without further ado, allow me to reintroduce them. We have Dr. Stephen Omondi, who is a physician and also a cardiologist, and next to him we have Madam Josephine Mbuthi, who is a nutritionist. Of course, it goes hand in hand. And before we went for the break, you will tell us more about in regards to how, and you've talked about a promotion. You know, anything heart condition, diabetes, these are some of the issues that bring down a lot of families in regards to the costs. A lot of vehicles have been sold, cows have been sold, land has been sold. How exactly is you guys as current hospital coming in, because you've talked about a promotion, you'll tell us a little bit more on that. But we have talked about heart diseases, and the last time Doc has mentioned even in kids where we find some heart conditions in kids. Is this an isolated case? Because we've had, also my mom has issues of hypertension, and she is at least 8, she's almost 80 years old. But we are talking about kids. And when you talk about lifestyle, we have a lot of people who are obese, who are quite young, some are old. Do you have any age where somebody is a little bit more vulnerable?
What I will say is that all heart failure is not usually a respecter of age. we also even have congenital heart diseases. But what we usually say, it starts right from the womb, and that's why we encourage mothers to just go for their antenatal checkups. They get their ultrasound checked up and all that. But sometimes you find that even after these children start maybe eating meals, and that is around complementary feeding starts at 6 months, you find that it's the awareness that the mother has of what foods to give the children, so that even if they are growing, they are developing in terms of other organs inclusive of the heart, the meals that they're having are able health-wise to actually support those organs that they're growing. But now you find that women, or basically mothers, focus mainly, maybe because of the cost of meals, and especially right now the food prices have really gone high. You find that mothers focus on basically vegetables and carbohydrates, or basically proteins and carbohydrates, mainly because it's now costing much to even have a balanced meal on the table. So you find that focusing on one group of food will give you a lot of energy, so that is when now an increase of energy consumption now will lead to storage, and that will now lead to overweight and obesity. And we're having that a lot even in the children right now, and even the schools they are going to, there's not much activity, unless maybe when they close down schools, or even with, and especially in the Nairobi setups, you find that many kids, most of the children are not doing activities. So it's mainly television or basically their gadgets. So we are basically educating and creating awareness, but you find that most people, because of their awareness, they think that heart failure is mainly in adults, and that is why you find that most of the people actually who access healthcare are adults. But of importance to note is that many people come to the hospitals when these symptoms have already set in. So you find that nutrition is actually for prevention, and that is why even the promotion you're talking about, you're encouraging people even during this Valentine's
it's tomorrow.
yes, it's tomorrow. Kindly get your spouse or even your partner basically a package of checkup, and right now they've been designed in a way it's even pocket friendly. You find that even with 10,000 you can actually get a checkup. You don't really have to wait for you to be unwell for you to actually go for checkup. And the good thing, I don't know about most of the hospitals, but in Karen, all of these checkups have nutrition. And that's why now you come to me, I educate you, I create awareness, we discuss about diets, because diets are individualized. They are not one diet for everyone. If that was so, we wouldn't be there. But because of the fact that these diets are individualized, we'll sit down with you and actually look, what have you been doing in the past? What goals can we set down? And then I educate you, these are the healthier foods, these are the foods that once you eat, they can actually put you at more risk of either diabetes, hypertension, obesity, overweight, which are basically a precursor of heart failure.
Yeah, and also be looking at the nutrition, looking at the past couple of days, the high cost of living, the high cost of food prices. A number of Kenyans, even the working class, cannot put even 3 meals on the table. And you're telling us now we need to observe a strict diet or some sort of a diet so that we may not get into this. You will tell us a simple regimen that we can adopt, and especially for people who have conditions, not only heart diseases, we have diabetes and others as well. But Doc, I'm talking about the heart, heart diabetes. These are some of, if you ask me, the most expensive diseases, kidney diseases, most expensive diseases we have in the country. And as the hospital, you've decided to come up with a project, or more or less like a scheme that Kenyans can get not only advice, just like Madam Josephine has talked about, but check-up at subsidized cost. Tell us about that.
Yeah, so when you talk about the cost, it depends on where you are meeting the cost. So as Josephine is saying, prevention will cut off most of the costs. You've said correctly that the most common causes are hypertension, things like diabetes, cigarette smoking. A lot of people with these diseases get them because of their lifestyle, their lifestyles. So you can start by preventing at that level. Now, people may not be aware. So in Karen and other places as well, they have wellness clinics where you can come at least once every year, have some of these things checked, have your blood pressure checked. Not because necessarily that single blood pressure reading, but it establishes the habit that I'm aware that this is a risk. I need to keep on checking my blood pressure from time to time. So just coming for wellness, having your kidneys checked, makes you be aware that the kidney is an organ that's important, and we need to check how it is working. Now, if you meet the cost at that point, it's not very costly. And from time to time, we have campaigns, like actually now we have a campaign where there's, right at the entrance, there's a camp, there's a tent where we're checking your blood pressure as you come in, and just looking at your weight and giving some recommendations based on those. But then there's also a clinic that runs every day, in fact every day including Saturday. Not always, it's only off on Saturdays, on Sundays. Now that clinic is a wellness clinic. It has got a dedicated team. You come in, they'll talk to you, and they'll do some of these checkups. Now when you wait for the blood pressure to be established as a condition and the diabetes, the costs they go up. So when that time comes, now we are at the point where you now prevent the complications. And one complication of these conditions is heart failure. So you'll prevent them by taking your medicines as prescribed. And just when you say maybe a bit later, some of these things can be reversed just by changing your lifestyle. So even at that point, you can just reverse your, just pay more attention. And I'm glad in this studio, you are all small-bodied. So you're already doing the right thing. And a lot of people are actually becoming aware of the effect, the effect of being obese or smoking cigarettes. So you don't yet see a lot of people smoking, but we're not where we're supposed to be, and that's why we have this kind of shows. Now, once the heart failure is established, the cost goes up. So it's an incremental cost, yes, it piles up, and you don't want to get there. But when you get there, there are good medicines. In fact, you can get medicines at a cost of about 1,000 bob a month, which is a lot for many people, but it will prevent you from reaching a point where you can't work, and the heart failure becomes a major problem. Sometimes it can even lead to a loss of life, and this can be prevented. And the devices I was talking about, the cost is partly normally borne by the patient, but partly the government, like NHIF, while it has been running, it chips in. Actually, sometimes it pays a quarter to half the cost of these procedures. So many people still cannot reach cannot meet the cost of what is required. But at least there's something happening, and there are ways in which people can be helped to meet the costs that are required. But I'll say again, just work on prevention. When you see your weight is reaching a certain level, try and cut down the waste. There's not much cost in that. And the foods you're talking about, the wholesome foods you're talking about, are not as costly as the fast foods. The cost of eating 100 grams or 200 grams of ugali, you cannot compare with the cost of eating chips or, yes. So choose the wholesome foods that are not dangerous to your life. And then just keep monitoring the weight. That does not require a lot. Even as you walk in the corridors of, you will see, in most of these places you see weighing machines, just take your weight and be aware that I need to be a certain weight to prevent these conditions. So yeah, but once it is established, the cost can be quite a bit. And if you're at that point, you can be helped to meet the cost by the government partly. It's not a big package, but let's try not to get there where now we have to meet the cost.
And I've also noticed that a number of hospitals, I'm quite sure even Karen Hospital, when we have awareness to a certain disease on that week or on that month, you have some subsidized rates to cushion Kenyans. So how much are we talking about if I am to come today?
Yes.
To the hospital to have a wellness check in regards to my heart? How much are we talking about?
So the first waiver that you'll get is a free consultation, which typically is to see a specialized doctor is about 3,000 to 5,000 shillings. That cost, once it is waived, that's a big cost. And then when we run these campaigns, we do the ultrasound, the echo. We do them normally at half cost. So that will be like 3,000 to 4,000 depending on which campaign we are running. And the ECG, which is usually about 2,000 shillings, may be the half of that cost. So during these campaigns, the costs indeed are way subsidized, or at least some of them actually waived. Yeah. And
Madam Josephine, I'm looking at the Kenya as a country of extremes. When we don't have food, and even some people in some years we reported some deaths in regards to lack of food. But when we have extreme, that is where you're coming in and saying that you should watch your weight.
Yes.
Based on the current economic turmoil, what advice can you tell Kenyans in regards to observing not only their weight, but what they eat?
Okay. Maybe I can start by saying, according to the deaths, malnutrition is not just the thin person that you see who is almost dying, but actually overweight and obesity is malnutrition, because malnutrition is either an overindulgence or an meet or basically nutrition needs. And what I can say, and especially let me even talk to mainly the town setup people, is that we have been, as we are growing up, we do mainly the vegetables, the plant sources of foods. But once you start working, once you start earning an income, you find that they shift from actually taking the healthier foods to actually taking more of the foods that are actually leading to some of these conditions. And that is why you find that, like right now, a kilogram of meat is costing about 600 to 700, or even 800, depending on which part of Kenya you're at. That same 1 kg of meat, which you will take maybe as a family one sitting or even 2 meals in a day, is the same cash that you can actually go and maybe buy a kilo of beans. Like now a kilo of beans is going for from about 150 to 250 per kilo. And when you boil that kg of beans, you find that it takes you to even about 2 to 3 meals. Yes. So I think it's basically educating the people, knowing that if you have that 1,000 shillings, if you want to do mainly meat sources or maybe this, the highly refined foods, then it will only cost you a meal. But when you start feeding on foods that you were brought up with, it's actually cheaper. Okay, so even as you come into the nutrition department, or even when you come into a consult, we'll sit down with you and see, do you have a space even for kitchen gardening? But if you're in Nairobi, what are the parts whereby you can even get the same 100, you can actually get more vegetables even for that 100. So that is why I was saying every individual is different. Even as you come in for a consult, like Dr. Omondi was saying, like right now, even for the checkups, all those checkups have a dental checkup, have a nutrition checkup. Even on that, let's say for example, even the cheaper one, even during, even off the campaigns, it's usually about 15,000 shillings. Right now, it's going for about 10,000 shillings. And the same package has a doctor's consultation, has a nutrition consultation, and has a doctor consultation. So don't wait until those symptoms have started emanating for you actually to go for checkup. Just come and sit down with me and just say, I need my family to actually live longer, or basically more of a quality life, because God is the one who, who gives you the life in itself. But we want people to live a quality life. Let's get to 90 when at least we really don't have hypertension or heart failure, other than even get to 50 and you have a pharmacy of medications. So nutrition is very key.
And still on that, I've noted we've also become doctors on our own, intermittent fasting, the NITO. You find that at work we have some huge tubes, having some lemons and some ginger. And you'll find I will skip lunch, you know. Sometimes you'll find that I will skip breakfast, or one of the 3 meals, I'll skip that, and then I'll be taking some things here. Is this sort of a regimen? Is that with a menu or something, a menu? Is it recommended from where you stand?
Okay. This is what I will educate the public. These diets, most of them are what you call fad diets. Diets, there are some diets that were just designed for a particular purpose, and especially the runway models. You find that they will do a particular diet like intermittent fasting or the keto diets, basically to lose certain kgs, basically to fit on that gown, just for that particular purpose. But you find that it has bloomed. You find that now people are using it as a day in, day out diet. And it has its pros. Actually, science has not been able, in an extent, to actually research on some of the implications of this diet. Because you find that most of the purpose why people are doing that is to have a smaller figure. But you see, you're starving. You're actually starving to get that smaller figure. For you, for me as a client, I want to lose that fat, or basically that weight. But by the end of the day, are you getting enough nutrients? Because you're practically starving. So you could be on those diets, and actually you're increasing your risk factor for heart failure. And
at the office, people think that you're doing meal smart. But as we wrap up, Doc, kindly tell us, every patient's case is unique, and how can a doctor identify the different perspectives in regards to how heart failure affects different individuals, as we wrap up?
Yes, so we hadn't touched on it yet, but heart failure we said it's an umbrella term, it's a syndrome, and you arrive there from many other, as a complication of other diseases. Now, I hadn't said before what's the most common symptom. So the most common symptom is actually shortness of breath. You feel that you are hungry, you're not getting enough air into your lungs. And when you notice that symptom, you may notice it while you are walking, or you may notice it while you're lying flat. So that when you notice that, please see a doctor. It could be that you're having established heart failure or something that related to it, but that's the most common symptom. The other symptom that occurs is you tend to retain fluid, so you have leg swelling. When that occurs, then you need to see a doctor. Now, these symptoms of heart failure, they tend to be common across, but now heart failure is different because we say we have got left-sided heart failure and right-sided heart failure, and the causes are different. The treatment actually is different. Now, once you have these symptoms, you need to see a doctor. Now, the impact to the patient is not just about how limiting these diseases are, because they limit your physical activity and your ability to do many things, but also they are limiting in terms of cost, as we just talked about here. So those are shared aspects. But what I want the patient, from what you're asking me, to know is that the common way it presents is the same, is almost the same, but there are different entities in there that are treated just slightly differently, and that requires a doctor. Indeed, many times it requires a specialized doctor to look into it with this device I'm talking about, like echo, and then tell you this is what you need and treat it. Yes. Not all heart failures are permanent. Some of them are reversible. And even picking up which ones are easily reversible is also under the purview of being seen by a doctor who can tell you what to do. And some heart failures occur after pregnancy, and some of those will be reversed. Some heart failures occur in childhood that she was talking about, and some of those just with simple surgery. Yeah.
And because we have it's 11th to 17th, your offer is still between these two dates, 11th or 17th, or somebody can pop in anytime?
So anytime, but for the next 2 weeks, we are running
the next 2 weeks.
We are running these subsidized clinics when you come in.
All right.
But there may be a small cost sometimes, because there are some tests that you may need to do. But believe me, just talking to somebody about your symptoms and getting is an important step to make towards the right. Yes. And then we don't see it. We're beginning to see, increasingly, we're beginning to see a lot of people with coronary artery disease. Coronary arteries are vessels that supply the heart muscle, and those get blocked when you have diabetes or hypertension or you smoke, and that presents with chest pain. And that, again, is something we easily treat in current. So if you have chest pain that either comes when you're exercising or that comes suddenly, that's something we need to see us for as well.
Thank you. I'm hoping that between those the 2 dates, at least we also have another discussion to maybe see where we are in regards to heart failure in the country. Remember, we are Heart Failure Awareness Week, and I've been engaging Dr. Stephen Omondi, who is a physician and a cardiologist, and we also have Josephine Mbuthi, who is a nutritionist, both from the Karen Hospital, and they say for the next couple of weeks they will be having subsidized rate in regards to checking your heart and in regards to the treatment itself, which is quite a good initiative, especially coming from a reputable hospital like Karen Hospital in regards to helping us out in our health. And of course, thank you so much for making time for KBC News Check. My name is Njue. We started with Byron Abuli. Now we have Lensa Odingo. I'm now giving the baton to the Swahili desk for Kurunzi Mashinani and Tamrini. Do have yourself a blessed day.